this morning's Healthy Living, Mark Hardison joins us from Springhill Pharmacy to talk about diabetes and insulin. Good morning, Mark.
Good morning, Joe. How are you?
I'm fantastic. Good to see you here on Studio 10. Let's start with insulin and how does it work in the body?
Well, Joe, insulin's a naturally occurring hormone that is produced in the pancreas, and it works as a key to kind of unlock energy so that the cells can function normally.
Are there different types of insulin?
There are, Joe. There's about 3 different basic classifications of insulin. There's a short-acting, intermediate, and long-acting insulin.
So why or how does a person become diabetic?
Basically, there's 2 types of conditions. We have what we call a juvenile onset, where the pancreas, for some reason, is not able to produce enough insulin for the body to use, or either they also believe that a virus may affect the pancreas. The other type is a type 2, which is more common. About 90% of the people have type 2 diabetes, where they just have the inability to use the insulin that their body is producing.
Okay, so if someone is diabetic, let's talk about these different insulin devices and how they get that into the body then.
Sure. The most common way that people are most familiar with is the vial and the syringe, which is an older method. There are some newer types that are available out there, and I brought with me today a couple of samples of some products called Insulin Pens, and these devices are very, very convenient. They're very discreet, and really about 90% of the world uses an insulin pen.
Okay.
One reason why I like it's because it's very inconspicuous. You can almost just literally use it like a pen, as I put it in my pocket here.
Right.
It's also great for a patient who is visually impaired, has difficulty seeing or hearing, and dexterity may be issues. You just simply dial and click up the number of units of insulin that you need, and it's very easy to inject into the skin.
So how do you inject it then? How does that part of it work?
Well, simply you have a needle that attaches to the end of the pen. You dial up the amount of insulin desired, and you just simply do a subcutaneous injection into your body and into the desired area.
Pretty painless?
Very painless. Unbelievable. As a matter of fact, I've got a teaching technique that I try to teach people with when they learn how to use the needle, and especially on the pen, where they simply have them hold it up against their body and breathe in and ask them to breathe out. And next thing you know, they've already injected into their side and they didn't even realize it. So the pens are very, very comfortable.
Last thing then, if anybody has any questions about diabetes or how to use insulin properly, can they get in contact with you guys?
Absolutely. Feel free to contact us at Springhill Pharmacy. We're located on the campus of Springhill Medical Center. Also, I'd like to recommend the American Diabetes Association. It's a wonderful website, diabetes.org.
All right. Mark Hardison, thank you so much for joining us here on Studio 10.
Thanks, Joe. Enjoyed being with you.
Appreciate it.